Situated on the East African coast, Kenya is a country that is indeed blessed with endless contrasting landscape. The pristine sandy beaches on the Kenyan Indian Ocean coastline is a haven for tourists from all over the world. The rolling plains and savanna that teem with enchanting wildlife are a feature unique in Kenya, with a wide variety of fauna and flora. And for the visitors, it is a chance to see the big five at close quarters and other species of smaller game. And into the interior are the high-potential agricultural highlands, home to Kenya's premier export products, tea and coffee. However, Kenya is a country with a fast-rising population, currently standing at slightly over 30 million people. The country's resources are stretched to the limit, with millions of people subjected to poverty. Kenya's capital city, Nairobi, with a population of around 3 million people, hosts some of the largest slums in Africa. This is the Kibera slum, located in Kenya's capital city, Nairobi. Kibera has a population of about 1 million people. A major characteristic of this slum is poor housing, poor sanitation, lack of clean drinking water, waterborne diseases, insecurity, and poor communication infrastructure. This is what defines the squalid life of the residents of the Kibera slum. Government agencies and non-governmental organizations have been involved in efforts to assist residents to alleviate their living conditions. However, the AIDS pandemic that has descended on Kenyans as a bushfire over the last 2 decades has reversed development gains achieved in the past. And people living in the urban slums have heavily borne the brunt of the HIV/AIDS scourge. One notable organization that has been at the center of assisting both the infected and affected by HIV/AIDS is the Kibera Community Self-Help Project, KICOSHEP. Founded in 1991 by Mrs. OWITI, a born-again Christian and a church minister, KICOSHEP is involved in a number of programs that include creating awareness about the dangers of HIV to the individual, the family, the community, and the nation as a whole, empowering the community to care for family members of people living with the HIV/AIDS with basic needs, education, and other rewarding skills. Supporting people who are affected by AIDS, especially women and youth, to start income-generating activities by providing them with a training in business skills and starting capital. Providing easy and accessible healthcare services, for example, treatment, follow-up services in the community, and family planning services.
There was need for such an institution to be in such a place. It was high time that people in the community get an institution like this where they can come to get information about HIV/AIDS, and also where they can get people who can care for them when they are sick with HIV/AIDS. And also the main objective was to train the community to get information on HIV/AIDS, how you can protect yourself from HIV/AIDS, how you can also, when do you get HIV/AIDS. And the major thing was also to care for the children. I love children, and I always thought I wanted to care for children in a large way.
One of the main challenges of the war on the AIDS scourge has been silence from the sufferers. Through public education and awareness campaigns mounted by KICOSHEP, many people living with the HIV/AIDS have been sensitized on the importance of going public about their status. And for those who have gone public, they have benefited immensely through KICOSHEP's counseling and healthcare services and are able to live positively with HIV/AIDS.
Mimi napigia KICOSHEP asante sana vile walikuta mimi kama mimi iko na virusi, lakini walifundisha mimi vile mimi naweza kuishi na hii ugonjwa, vile mimi naweza hata kusaidia mtu kama mimi kama anakonjeka, vile naweza kuongea na mtu hata yeye pia apate usaidizi kutoka KICOSHEP.
Due to the counseling that I have been counseled by KICOSHEP, and also involving my wife and my other family relatives, actually it has helped me, because now I'm living in a good life that they care for me and also help me in all ways. In that they also went as far as looking for something that they can encourage my wife to do so as to help me. And since that time, both of my family are really caring for me and love me in particular.
KICOSHEP has forged a strong working partnership with the Government of Kenya and the United States Center for Disease Control, CDC. This has enabled KICOSHEP to establish voluntary counseling and testing centers, VCT, at 5 sites within Nairobi and its environs.
Since March of 2001, CDC has provided a number of things to KICOSHEP, including training of counselors. We also have provided HIV test kits to them and the lancets and so forth, other commodities that they need, so that the counselors can do the testing right in the counseling room, right in the slum where KICOSHEP works. And we're very pleased that KICOSHEP is committed to serving this very disadvantaged community, living in really very terrible living conditions, but KICOSHEP is providing really some hope to people in this community and some very much needed services.
Voluntary counseling and testing services have greatly assisted to prevent the incidences of mother-to-child HIV transmission.
It's 2 years now since I noticed that I'm HIV positive. It's when I was pregnant and then I was sent for tests. When I was tested, I was found that I'm HIV positive. When I was in labor pain, they gave me Nevirapine, and then after birth, they gave my daughter also another medicine, which I don't know its name, but they gave her medicine. And then they helped me with this powder milk known as NAN. When she was above 6 months, they gave her FLA for which. They usually do field work. They visit us in the houses, and then they do counseling for us. In many ways, they help us. Even they can provide food at times. Yeah.
The Kenya government, through the Ministry of Health, provides services at its hospitals to AIDS patients brought in by KICOSHEP.
As a government hospital, we have policies that have been put in place whereby we are supplementing or complementing what the NGOs are doing in the community. Here, the Ministry of Health has actually collaborated quite heavily with KICOSHEP in terms of taking care of the PWAs and their families by provision of medicine, provision of foodstuff, and follow-up and social support and counseling.
KICOSHEP has instituted home-based care programs where people living with AIDS can receive family love and support right in their homes. Family members and the community are counseled and trained on how to take care for their terminally ill patients. And for those who have no families to care for them, KICOSHEP has recruited volunteers from the community, and together with its own trained nurses, social workers, the youth and religious leaders, patients are visited and assisted in various chores. These include washing of their clothes and linen, changing and bathing, as well as cooking for them. On this particular visit, one of the patients, Fatuma, had already been rushed to the KICOSHEP clinic when her condition deteriorated. However, her neighbor was at hand to let the volunteers into the house to perform the routine duties. KICOSHEP runs a hospice in the Kibera slum, where it operates a 24-hour walk-in service that encompasses general treatment, maternity, counseling, condom distribution, HIV/AIDS awareness, and immunization. The center has a community pharmacy where drugs can be bought at a minimal charge. There is a 3-bed ward for 24-hour patient observation before transfer to a government hospital where they are seen in the outpatient clinic. The number of AIDS orphans is increasing in Kenya. Such children suffer a multitude of problems having lost their loving parents. KICOSHEP has established a primary school where AIDS orphans are provided with free education. The school, while offering education, at the same time has a feeding program for the children. 400 children attend this school, with over 80% being orphans. Evans is a Standard 6 pupil who lost both parents to HIV/AIDS. Together with his other 6 siblings, left to the care of an aging grandmother, they have found refuge at the KICOSHEP school.
My mother became sick and she tried to treat herself, but she came well sometimes, but the sickness did not let her rest. She became well again, sickness came, and in 1997 she died. KICOSHEP has helped me with a lot because they give me clothes, feeding program, and sometimes they pay rent for our house, and schooling, we learn free, we don't pay school fees, and even sometimes we carry food from here, take home. And my grandmother does not have money to buy this food. I just come and tell the teacher, and the teacher understands, and she tells me after school I go and see her. When I go, she takes some food, give them to me, and I go with them home.
Empowering AIDS orphans to be economically independent is one of the projects KICOSHEP runs at this center. The center has trained over 80 orphans to date, who are either employed or self-employed.
When we started this training, actually we didn't know that we would do a lot, but now we are finding ourselves doing so much in the community, because there are some of the youths their parents are sick and some of their parents have died, and they're just left in the community without doing anything. So they're depending on KICOSHEP, and so KICOSHEP has really come up in this skill training to help the youths outside in the community.
Love, as we say, is a kind of...
And for the youth being the most vulnerable and at risk of contracting HIV/AIDS, KICOSHEP has established a youth center. The youth in the community can walk in and interact with their peer counselors, discuss issues that relate to their sexuality, and get counseling services. The youth at this center have been very instrumental in the HIV/AIDS awareness campaign in the Kibera slum community through song and drama. Demystifying the disease, breaking the silence, and promoting behavior change among the youth is the hallmark. KICOSHEP has a monumental task of alleviating the suffering of the people in the Kibera slum. As the chairman of the board of directors explains, it intends to expand its geographical scope.
We are planning to open branches like Kisumu, in the sugar belt. We are planning to, we have already opened a branch in Machakos, and we are planning to open another one in Mwatate, in Taita, and then to expand up to Mombasa. Yeah, because the burden is so big, and the workers are few.
Expanding their geographic focus is one challenge. The other big challenge that we see for the future is moving from sort of supportive and palliative care of people who are living with AIDS to active treatment. The price of antiretroviral drugs is continuing to come down. However, giving antiretroviral drugs to people is a much more technical and sort of clinically demanding role than just giving some sort of palliative support to people. So I think it will be a big challenge for KICOSHEP to move from a sort of supportive care model to helping people get these drugs, monitoring them on the drugs, helping people deal with side effects of the drugs, and helping people who are on these drugs for many years. But we see that as the future.
According to the effort that I've seen KICOSHEP has done to us, particularly to the people living with HIV/AIDS and orphans, I could like to give this appeal to anybody who will be willing to help KICOSHEP.
KICOSHEP is a helpful organization, so if they don't mind, they can help them to at least to assist these people who are HIV affected, maybe with school fees for kids, because we are not able.
Also, I would want to thank the people who have really supported us for the last 13 years on running this project. But I would ask people to donate to us anything in kind. It doesn't have to be money, it can be anything: books, clothes, food, drugs, and of course money if it is possible.
Other orphans out there, I'm praying to God to help others so that He can give others good heart. People who would like to help those orphans to just go and help them, and God will reward them.